The MNSure program, I think, has been accurately portrayed as a train wreck. The state spent $160 billion rolling out a website that didn't work. The executive director was in Costa Rica during the rollout while it melted down. The program has enrolled only a third as many people as projected, and of those enrolled, only 17% are on private plans. Few enough that there's some real worry that there isn't enough money to support the something like $60 million a year it's going to cost to run the board. The rest of the 83% are on Medicaid and Minnesota Care, which we didn't need an MNSure exchange to do. Preferred One recently pulled out of those 17%, 60% of them, so we're down to, what, 8% or 7%? And they said it was financially and administratively unsustainable to stay the exchange. Since you were the chief author of the bill that created MNSure and co-chair of the Legislative Oversight Committee responsible for it, can you tell us what went wrong and what you would do differently if you had the chance to do it over again?
I'd hire a different vendor, without a doubt. The vendor that got the website going did a really poor job, and as a result, the rollout was terrible. In terms of the competition among the vendors, among the various plans, they've done a phenomenal job of competing with one another. It's a very fierce set of competition that has driven down prices, and that's why we have the lowest prices for health insurance anywhere in the country. But the thing you've got to remember also, and I've never heard you, Don, talk about repealing MNSure. I've heard you criticize it, but I've never heard about repeal. And maybe in your 30 seconds you can say whether you support repeal. The reason I carried it, the chief reason, was because Minnesota has done a phenomenal job of building a healthcare system. And if we didn't adopt our own health exchange, the default was a federal version. Now in Wisconsin, where they opted for that, they've got rates that are 85% higher than they are here in Minnesota. And Minnesota and Wisconsin are not that much different. But the chief difference is the fact that we did our own. We've got lower rates. We also, as you alluded to, we've seen 160,000 more Minnesotans get health insurance as a result of either MNSure or going into one of the public programs. Now, why should you be concerned about the public program? Because you're starting to think, well, this is just, that's money coming out of my own pocket, right? The fact is those folks get health care when they don't have insurance. But where do they go? And what do you want to take a guess? Where do people without insurance go? Smart folks over here. They go to the emergency room, and it costs 1,000 times more. And those costs just get passed along in the form of higher property taxes or in the form of higher income taxes. So you're paying for it one way or the other. We've got 40% more Minnesotans have health insurance. We're now the number 2 state in the country as far as providing insurance or people having insurance. Those sorts of things, as well as the competitive rates, are excellent, excellent outcomes. But we did need a different vendor to get the website operating well.
Well, it would be nice if so many problems could be fixed by a simple switch of vendors. I think there was more at work. I also think that there's a lot more to the failure of MNSure than just we may have the lowest healthcare insurance in the country. That says nothing about whether we have care. And when people don't have insurance, they go to the emergency room. But there are studies out there that show that even when they do have insurance, they go to the emergency room.